Well, let's get started here. We've got an incredible webinar. I love this topic. Okay. Longevity right now is very, very trendy. And like, it's so silly to say that it's trendy because, living longer is a good thing. And so, you know, num there's so many components to living longer. But if we don't take care of our heart, then well, we're not going to live very long. So we're gonna talk about that, talk about the things that create cardiovascular disease. We're going to talk about some specific products, but some housekeeping at the beginning here. If you have a question for me, you can put it in the question and answer box, and we have Rose on board from CanPrev answering questions in the back on the back end in the question and answer box. And if she can't answer it, she then I can look at the questions at the end. This webinar should be just about 40 minutes, hopefully a little bit less, and then we can answer questions, have a conversation at the end. And so the questions don't belong in the webinar chat. Okay, so if you write them in there, won't answer them because there's a lot of great questions. So we like to keep it to one area. So in the Q&A box, put the questions, please. All right, I'm gonna close the webinar chat and let's get this party started. So first things first, prize pack giveaway. This is awesome. So we have a bunch of packs that are going to go, or a bunch of products that are going to go to one lucky winner. And we're going to be learning about these ones throughout the day, throughout the next 45 minutes. Okay, a little bit about me, because I haven't introduced myself yet. I am Dr. Rory Gibbons. I'm a licensed naturopathic doctor in British Columbia. I have 3 boys, now 6 and under. It says 5 and under, but I didn't change that because my oldest just turned 6 last week. We have a busy household, not saying to say the least. Do have a pretty tight focus on men's wellness, and I see a lot of people coming to me for longevity reasons. They're like, oh, I've turned 40 or I've turned 50, and suddenly like I need to get myself in order. Got to get some blood work done. I'm going to do a whole health check, and those are the guys that I really love working with. Or I mean, I love working with everybody, but that is like my jam. Is like pure preventative medicine, heart health, longevity. That gets me fired up. Um, Tools that I use in my practice, blood work. We're going to talk about blood work today a little bit, diet and exercise prescription, and functional nutrition. And when I say functional nutrition, I mean things like CoQ10, magnesium, vitamin D, vitamin K2, those kind of things. That's functional nutrition to me. It is biochemistry, really. Even though I didn't really like biochemistry in university, I do really enjoy this part of medicine now. I am the co-owner of Virtual Health Collective, and this is an online wellness clinic that I've created with my wife, who's a naturopathic doctor, and we serve young modern parents in British Columbia all over, and we can reach them virtually. It's just the best. Healthy Planet raised a hand.
Sorry, Dr. Rory, we're not
Yep.
seeing the slides as you're moving through them.
Okay. Well, that's not very good. Pause. How about now?
Still not yet.
Thank you for interrupting and okay. Okay. I may have just stopped the entire webinar. Oh crap. Okay. How are we doing here? Can you see my slide now?
It says on my end, it says Healthy Planet has started screen sharing. Double click to enter full screen mode. But I'm not seeing anything. If anybody could let us know in the chat, can you see the screen? Black screen.
No, nothing. Okay, no problem. This is what we're gonna do.
Thanks for bearing with us. Oh, there we go. We can
What do
see
you
it
see
now.
now? It
Yep.
says, let's get familiar with your heart.
Yes, it does.
Okay. What about now? Can we see this? Dr. Roy Gibbons, ND?
No. Oh, now we are.
Okay.
Maybe it's lagging.
You know what? No problem. This is going to be awesome. We're going to keep going now, okay? So we'll just continue on.
One last thing, is this being recorded?
Yeah. Yes.
Excellent. Thank you.
Okay, let's continue on. Sorry about that hiccup, everyone. So Virtual Health Collective, I own that with my wife. I'm a speaker and an author because here I am. I'm speaking about topics that I really enjoy. And then also at the bottom here, some guilty pleasures of mine. I definitely love coffee, probably due to the point number one over there. Salty chips are my go-to. Star Wars, anything to do with riding bicycles and spending time outside is kind of where I love to spend time. So this is what we're gonna, oh, this is where I stopped. So I'm so sorry. So let's get familiar with your heart here. This is amazing art, amazing, amazing organ. Okay, it beats 100,000 times per day. It Your heart is essential for pumping blood through the body. It's transporting oxygen and nutrients, and it gets rid of any waste products. So think about the cardiovascular system here. Cardio meaning heart, and the vascular meaning the pipes that deliver the blood to the cells. So there's a lot going on here. You know, we also have to keep in mind that this heart is a muscle. Okay, it's muscular and it's contracting, relaxing, contracting, relaxing. So that means there's also neurological connections here. And then the hormones like cortisol and norepinephrine, they act on certain receptors which increase the heart rate or decrease the heart rate or increase the contraction of the heart. So there's a lot going on at the level of the heart. So it makes sense that we should take care of it as much as we can. Let's take a look at like what it means to have an unhealthy heart. Okay. Um, you can have valve issues and valve malformations. You can have arrhythmias and other conductivity issues. So like the beat is incorrect or it's too fast or too slow. You can have certain contractile issues like atrial fibrillation, atrial septal defects. Those are holes in the heart. There can be thick hearts that develop over time. There can be inflammation of the package around the heart, and there can be, I said, slow heart rate. So these are some things that can happen in the unhealthy heart, in the heart. Okay, these are some things that can occur. But what we're going to focus on today is atherosclerosis. Okay, atherosclerosis is plaque formation in the arteries. Okay, this is the main player of cardiovascular disease or disease in the heart and the arteries. Okay, it silently progresses over time. We've heard that it's the silent killer, and it is. Like it starts really early. There's cadaver studies that show that there's plaque building up in teens and preteens at that level, and that's so sad. And we can change that. Okay. So, you know, plaque builds up, fine, but what actually happens, what actually causes the issue, or what is happening physically to hurt the person, okay? There can be an aneurysm or a rupture, okay, where the blood vessel like actually tears. Okay, it tears open and the blood spills out of the blood vessel and massive bleeding can happen. There can be an occlusion by a thrombus. So there can be a hardening of the artery and then a chunk of it comes off and then floats down and blocks another artery and causes a stroke or a myocardial infarction, okay, where there's a heart attack. Blocks off an artery and no more blood can go to that area and that part of the heart dies. There can be a critical stenosis, which is an eventual narrowing. It just goes, and closes off. later on, you can go back and look at this diagram. If you go into Google and just type in atherosclerosis diagram, this will come up. And I want you to just don't focus on the words down here, like these black letters. Just look at the diagrams. These are cross sections of arteries. All right. And we can see from the left to the right, this is a progression over time. Okay. So it's normal artery, probably like like a child. And then we get a little bit of development. Then we get more development. Then we get more. And then we're, later on, middle-aged to elderly, now we're getting into the problems if we haven't taken care of anything. And we can see here aneurysm or rupture where there's blood spilling out of the artery. This one is a thrombus where one of these chunks is going to break off. And then that's just stenosis where it's just getting completely broken. Or sorry, completely blocked. So cardiovascular, how do we create cardiovascular disease? How can we do that? Well, you got to have a bunch of things to kind of contribute to the formation of cardiovascular disease, okay? So elevated cholesterol and low density lipoprotein. And so most people have seen this on their blood work, okay? They're like, oh, I have high cholesterol. So you have cholesterol, you got cholesterol, LDL cholesterol, HDL cholesterol, triglycerides. And so you have to have elevated levels of the lower density lipoprotein cholesterols. And we're going to talk about that in a moment, to kind of define what that really means. We have to have an elevated blood pressure, okay? So anything over 120 on 80 is considered elevated. There are some other guidelines in the conventional world that say, like, this is when you need to medicate. This is a problem when you get to a certain level. And we also have to keep in mind that depending on the day, your blood pressure can change. So some people are going to be walking around with a blood pressure of 110 on 70, and they show up in my office and it says 135 on 90. I'm like, oh my goodness, okay. But they're probably just excited to see me, or they've had a really stressful drive to my office. Okay, so it can change based on the stress levels in the moment. Okay, but it can increase over time. You have to have a sedentary lifestyle, so don't move a lot. Obesity and overweight, these things contribute to cardiovascular disease. You have to have high chronic psychological stress, definitely a factor here. And you have to have elevated oxidative stress, because this is what's actually causing the damage in the artery. Okay, and it's like, think about shards of glass. If you put shards of glass in the artery, it's going to create damage, right? And this is what elevated oxidative stress is. So smoking and other tobacco products cause this. Drug use causes this. Poor diet, things like high in saturated fats and trans fats, sugars and processed foods, these all contribute to oxidative stress. And when these become oxidated or oxidized, then they become more dangerous, right? And then alcohol consumption, as we know, alcohol just doesn't do good things for us. So I'm not going to spend too much time on this, but traditionally, your GP or your family doctor will run some blood work to assess your cardiovascular risk. And what you'll probably get is a full lipid profile, total cholesterol, LDL, HDL-C, and TG, which is triglycerides. Yeah, and you probably get like glucose, hemoglobin A1C, which are sugar markers. You might get uric acid. It's a marker for gout, but it's also a marker for cardiovascular disease. And if you see them in person, you'll get your blood pressure checked. That's what the go-to level is, okay? When I'm seeing patients, I want to be more specific. And that's why people come to see me, is because they want more information. And so I'll do those things that I just said, the lipid profile and the insulin and the sugars, but I'll also look at fasting insulin, because maybe they are on their way to diabetes, but it's not coming up with their glucose and hemoglobin A1C levels. Maybe if we run ApoB, we get to see actually how many low density lipoproteins are floating around, which are the ones that are most easily oxidized in the arteries, causing the issue, okay? We can run these other ones, LPA and LP big A. And these are other cholesterol markers that can give us a really great indication of your cardiovascular risk profile. And then there's this other thing called Smart Vascular, and this is a really great test that shows how close you are to having a broken off plaque, right? Or an unstable lesion in the arteries. These are all done through your Life Labs or any other local lab, and any GP or any naturopathic doctor can request these. I can't remember what the regulations in Ontario are as far as lab work goes, but we can run them in BC. This is for your information for later. So let's break apart the cholesterol conversation here. So here is a lipoprotein. Okay, so a low density lipoprotein is an LDL. Okay, cholesterol isn't necessarily bad. Okay, might be a little bit confusing, so I'm going to keep it very simple. So cholesterol, LDL cholesterol and HDL cholesterol, they're the same. Okay, but the LDL and the HDL are different. One is low density, one is high density. Okay, and so cholesterol is really just an innocent bystander in the progression of plaque formation. Okay? If you look at the formation of atherosclerosis or the formation of plaques, cholesterol comes in later and is sucked into the wall and made to be the fatty streak. Okay? It's just floating by, minding its own business. But it's the LDLs that are oxidizing, creating the issue on the artery wall, creating an immune response, and then the cholesterol comes in. So back in, the 70s or 80s, we found cholesterol is causing heart disease. We got to stop eating fat. And then we started eating more sugar. And so because we got to replace it with something, right? And now we have increased rates of metabolic disease, which is insulin resistance and obesity and heart disease and high blood pressure. And so this is why I run ApoB, okay, to make sure that we are assessing the number of LDL particles. Okay. If you're looking for more information on this, there's a really great webinar or a really great podcast snippet by Peter Attia talking about cholesterol. It's about 20 minutes long. Anyways, I wanted to bring that up because I know people are wondering about that. There's a lot of information online about this, and it can be confusing. So managing cholesterol levels, yeah, we do need to manage it. Okay, we do need to look at these levels and pay attention to them. Here are some research-based diets to control cholesterol. These are very well researched and very well put together. The Mediterranean style of eating. This is one that I adopt personally, and this is one I kind of pushed, or not pushed, but I recommend to my patients. It's like a very well-rounded style of eating. Like you eat a lot of different things, and like think about what they eat in Italy. Okay, lots of colorful vegetables, lots of colorful fruits, lean proteins, fish, olive oil, olives, avocados, avocado oil. So a lot of great anti-inflammatory type foods and high in the antioxidant profile. And there's some really good research that suggests that the Mediterranean diet helps to prevent cardiovascular disease and prevent diabetes. The portfolio diet is also really interesting. It was developed in Canada, and it is a portfolio of foods that have lots of research that say they reduce cholesterol. So that's a good little, if you Google that one, there's a really great PDF document that kind of guides you through the portfolio diet. And again, it's pretty reasonable. Like you can make some really great meals with the food that's there. The one thing about the portfolio diet is that they really focus on what you can eat and instead of taking out what you cannot. Okay, so you're adding in good foods instead of just reducing and taking out the other stuff, like the traditional diet word kind of implies that you stop eating certain things. That's why I like the Mediterranean diet, because it's so wide in options. Dietary approaches to stop hypertension. I thought we were talking about reducing cholesterol. Well, the foods that reduce cholesterol, they also help to reduce blood pressure. So that's also not a bad idea to take a look at the DASH diet. So prioritizing these foods, like I just mentioned, fibers, fruits, and vegetables, lean proteins, whole grains, omega-3 fatty acids. So if you're going to build your plate, okay, get your plate, put a quarter, like a quarter of whole grains, quarter protein, and half fruits and vegetables. Okay, that's an easy kind of way of building a plate. When I say a quarter whole grains, I mean like put a quarter starch on there, right? Like brown rice or quinoa, and then make sure we're getting adequate omega-3s in there too. And we're limiting these types of foods. Okay, I know I just mentioned like try not to stop eating these foods. These will go down in number and volume if you start adding in the Mediterranean style of eating. Okay, they'll just naturally go smaller and smaller. Saturated and trans fatty acids, let's talk about those for a second. So saturated fats are anything that is solid at room temperature. Okay, things like butter, lard, coconut oil is saturated fat. It's also a shorter fat, so it's like not as bad. But I have to also be careful of what I say there because we do need to focus on unsaturated fatty acids. Okay, trans fatty acids, these are there was a big push to eliminate these from our diet in Canada, and as of 2020, I believe, artificially designed or artificially made trans fats should be banned. I believe that's the case in Canada. You still can consume trans fats in the form of beef and ruminant animals like sheep and cows. We want to reduce or limit like refined carbohydrates and processed sugar. So like, trying to avoid like the Wonder Bread, okay, like really processed foods or really processed buns and breads. Those are what comes to mind right now. And of course, candies and baked goods, commercialized baked goods. We want to bring those down in number because these things are driving insulin production and blood sugar blood sugar levels, which is also kind of goes with heart disease. And we want to also like try to reduce high cholesterol foods like in some ways here, like the high cholesterol food in your diet conversation is controversial online, okay? Because I know people go and Google this stuff all the time. I want to say it's controversial online. So about 10% of the cholesterol that we eat in our diet is absorbed into our blood, okay? 10%. So it's not that much, but if we're eating a high cholesterol food and the way we're cooking it is like frying it or even air frying it and it's oxidizing the cholesterol, then we can run into then our risk is higher. Okay. So like an egg, for instance, if we're gonna eat an egg, like that's not a bad thing to eat. Like, yeah, it's high in cholesterol, but also like we're gonna get 10% of that cholesterol. And there's other things that are driving cholesterol up. So I talked about oxidative stress, and this is what is causing physical damage in the arteries. So we should probably like reduce it, right? We can do it. Okay, so smoking, gotta stop smoking, or at least limit it. I know it's hard. Addiction is a whole nother beast, but you can do it. If you're a smoker listening here, and you're like, I know this is bad for me. I know I have a high cardiovascular risk. And I'm going to urge you to bring that down and stop it. Okay. For yourself and those people around you. There's options here. Okay. Medication can help. Okay. Cognitive behavioral therapy, some really great research on that. That's going to help you deal with the addiction part. And then habit modification strategies that can be really helpful too. Some simple things like putting your lighter in your glove box instead of your cup holder in your car. Okay. Or putting your pack of cigarettes instead of in your jacket in your bag. Okay. Like making it more inconvenient for you. These are called habit modification. And I do a lot of that in my practice, not just with smoking, but with other things, usually with like sweets in the house. Stress reduction. I mentioned chronic psychological stress can be a real driver of oxidation in the body. And also blood pressure. Right? When we're stressed out, our blood pressure goes up. And we want to try to reduce that and just not reduce it to really low, but just like within that normal range. So some things you can try, modifying your work schedule and your daily tasks. Like if there's any way that you can change your work schedule where it's like, I'm going to work from home one day instead of going on my 1.5 hour commute each way. That's a long time you're sitting in the car not doing anything, where you could be at home, going for a walk, sleeping in maybe, getting some extra rest, and just working from home. Like if your job is open to that, then explore that. modifying your duties. If you can offload some of your tasks to someone else and let go of the responsibility of some certain tasks, then do it. Right? One example, when I hired a bookkeeper, that was incredible. I was like convinced I can do it all, but I hated it, and I also wasn't very good at it. And so once I started paying someone to do it, I could focus on other things. My stress level came down, and I just felt so much happier. Seeking counseling. Everyone should be seeing a counselor. They're amazing people. And even though you're like, I don't have anxiety or I don't have depression, that's fine. It's fine. But you can also benefit from mindset shifts. And it's also very therapeutic to talk about what is going on in your life at that time. If you're going through a hard time, you don't have to have depression or anxiety or bipolar to see a counselor. You can just be going through a tough time, or they can really bring out some great characteristics of yourself and also some great tools for you to work through stressful things. Uh, Taking part in some mindfulness activities, yoga, breathing activities, meditation. I changed the word meditation to intentional thinking because some people get freaked out about the word meditation. And I think it's all about sitting and meditating with some essential oils and a piece of bamboo. I don't know, but if you just intentionally think about something that you're grateful for, that can bring your blood pressure down. It can bring your stress down and just make you feel so much better. On that note, spending time in nature has been shown to be reduced cortisol levels, reduce blood pressure, increased feelings of wellness, increased feelings of happiness. That means going for a walk in the woods or going for a walk in a park or just sitting on your front lawn, just doing something outside and around nature. Modifying relationships. This is a big one. Can be a hard conversation with some people, but there are some people that have these toxic relationships, toxic friendships, and they're hard to break. But once you do, it can really be beneficial. Alcohol reduction, saving the alcohol for the weekend. Don't bank credit though throughout the week though. Okay. Okay, just push the alcohol to the weekend instead of having 2 drinks per night. Replace those on Wednesday with 2 bubblies instead, and have a beer on Friday or a beer on Saturday. Okay, just trying to move them to specific times. I find cutting it out completely, there is more relapse later. We are there's a lot of options for non-alcoholic drinks, beers, wines, spirits out there, and they're pretty good. And so I encourage you to go and explore them. It's becoming way more readily available. Maintaining healthy blood pressure. We talked about the DASH diet earlier. Consistent physical activity, weight management, limiting salt and alcohol intake. All of these things are contributing to increased blood pressure and reducing stress. So medications if you're hypertensive. Okay. If you go on a medication for high blood pressure, you are not a failure. Okay, I'm going to say that again. If you go on medications for hypertension, you are not a failure. Okay, it's not your fault. We can change that. All right, so go on a medication, bring your bring your blood pressure down. At the same time, though, do some more exercise, eat better, reduce stress. Okay, like we can do that. And medication has come a long way. Research is showing now that lower doses of medications can be just as beneficial as higher doses. All right. For instance, if you have one dose that's 10 milligrams, that's low, and you need more if your blood pressure is not coming down, instead of adding more of that specific medication, we might add another one at another lower dose. Okay, so lower side effects, same effect. Staying physically active, trying to get at least 150 minutes of moderate to vigorous activity. Here are some examples of what, sorry, these are not examples. So moderate activity means elevating the heart rate to a point where you're having trouble finishing a sentence. Okay, so going for a fast walk or mowing the lawn quickly. Okay, so you're elevating the heart rate. And there's more information on the Heart and Stroke Foundation of Canada on this, on what kind of defines moderate to vigorous intensity aerobic physical activity. Okay, so here are some suggestions to get you started. All right, 10-minute walks after lunch helps your insulin, helps your blood sugars, wakes you up if you're having an afternoon crash. Set your daily step goals. Mine's 10,000 steps a day. I just moved recently, so I've been crushing the step goals because I'm running around moving boxes and setting up our house. Work with a trainer or fitness group. I love this. This is my number one suggestion to people that are having trouble exercising. If you can pay for a trainer, do it. Consider it an investment in yourself, an investment in your health. Okay. The accountability alone is life-changing. Fitness groups are great. The accountability level goes down, unfortunately. I put down, have an accountability partner, not your spouse, preferably not your spouse, preferably someone that is not connected to you by family. Okay? I just say that in the most loving way possible. When you work with someone that is your spouse or your family, subjectivity goes down. Okay. Sorry, objectivity goes down, meaning there's more emotional connection there and it can be not as useful and it's more stressful, can become more stressful. And then daily squats, you can try that. Let's start with CoQ10, MRB. What is CoQ10? It's an antioxidant, plays an integral role in mitochondrial energy production. I love CoQ10. I use it so often, especially when people are trying to reduce their cholesterol with things like statin medication, because statins, some cholesterol reducing medications can reduce levels of CoQ10. We know we need CoQ10. It's an energy producing molecule. It improves endothelial function. In the CanPres formula here, it's a water-soluble CoQ10, and it's easier to absorb for people with low stomach acid or no gallbladder. Okay? So certain nutrients need certain enzymes to be absorbed. Okay, so this CoQ10 is great for people that are that don't have bile. Okay, that have low acid. I shouldn't say they don't have bile; they have lower levels of bile. Liposomals. I love liposomals because they're really, really well absorbed. Okay. It's a unique nutrient delivery system, right? The nutrients, whatever nutrient it is, CoQ10 or curcumin or fish oils or whatever, they are packaged in a phospholipid bilayer. Okay. So phospholipid bilayer means like a fatty layer. And when they are in that layer, they absorb through the gut more frequently or more efficiently. All right. These ones, the difference between this one and the MRB, CoQ10 MRB, is the delivery system, essentially. Okay. Nutrients are released as each layer of lipids is peeled away. Okay, so it's like a sustained release. Okay, it's a quick uptake, but it's sustained release. So it's like layer goes away, CoQ10 is released, layer goes away, CoQ10 is released and absorbed. No artificial colors, flavors, preservatives, animal products, and it tastes really great. I have tasted the CoQ10, love it. I find there are some CoQ10s out there that don't taste that good as far as the liquid ones go, but the coenzyme, sorry, the liposomal one, really good. Like, man, have a tablespoon, no problem. Drizzle it on something. Oh yeah, that's the stuff. Inoquinol. This is the most is a patented version of CoQ10. It is a really great. It's really well tolerated and stable in the body. So when we eat it, it's protected at three levels. Okay, and the sorry, I just wanted to look at one thing here. Yeah, I'm going to get into that. That's perfect. Sorry about that. So let's talk about that 3-level system there. Okay, so there's vitamin C in there. Vitamin C is a great antioxidant, right? So it stops the internal oxidation of the CoQ10. There's medium chain triglycerides in the product itself, and that helps it move through the membranes more easily. And there's also this other thing called annattoseed in it. And that's for external oxidation prevention. So there's something on the inside of the capsule that's helping keep the CoQ10 stable. There's something on the outside keep preventing it from breaking down. There's a couple different dosages, 100 milligrams to 200 milligrams. The reason why is you can mix up the dosage. So if you have a 100 milligram, you could take 300 milligrams per day. Or if you have 200 milligram, you could just take one cap and then you get 200. Okay? CoQ10, man, does a lot of great things and it helps with migraines too. Just a couple other things I didn't mention. I said something about energy really quickly, but any mitochondrial formula that you get is going to have CoQ10 in it. It helps with the cholesterol. It helps stabilizing heart rate, and also homocysteine. Homocysteine is really like is a molecule that's produced when you don't have like B6 and B9 in it. Sorry, I was talking about apologize, guys. Yeah, no. Homocysteine is a molecule that is made from something else, and we need like B6 and B9 and B12 there to help reduce the levels of homocysteine. We do have to be kind of careful with if you're taking things like warfarin or aspirin and certain blood pressure medications, but we can cross that road when you come to it. I think I'm just a little bit confused here because I was talking about inoculol, okay? And then we went on, and then we went to healthy heart, but this graphic is wrong. And we weren't caught talking about CoQ10. So I'm confused there. Healthy heart is a different product, okay? That's why I'm getting a little bit confused. So healthy heart is a well-rounded product for heart health, okay? Okay, so there's CoQ10 in it. There's some herbs in it that help to regulate heart rate. Okay, cholesterol in there, or cholesterol reducing nutrients, and there's also B6, which helps with the homocysteine control. Okay, now I'm sorry, I apologize, I messed that up. This graphic is wrong. It should be a healthy heart bottle there. This is healthy heart's a great one if for like maintenance. Krill oil, okay? We talk about omega-3 fatty acids. They are very good for us. So the Mediterranean diet, really high in omega-3 fatty acids through the use of like fish and olive oil. And we use this thing called Superba Boost. And it's an encapsulated omega-3 fatty acid in a phospholipid shell. It's a very well absorbed. Okay, that's why we use it. Krill is really interesting because it's not actually it's not a fish like swimming through the water. It's a little like um it's like a little shellfish looking thing. So take a look. Blue whales eat a lot of them, but they're really high in omega-3 fatty acids. This Superba Boost is eco-harvested Antarctic krill, and so it's really cold water. And we remove any unwanted salts there, which we know contributes to high blood pressure and cardiovascular disease. It has this thing called astaxanthin in it. It's an anti-inflammatory in the body, especially in the brain, joints, and skin. And so why would we take this? Okay, so we're reducing inflammation. This is what we're trying to do with omega-3 fatty acids in general, but krill oil does a really great job of this. It reduces inflammation, and we know that because it reduces CRP levels. So C-reactive protein is an inflammatory molecule, and krill oil or omega-3s turns this off. Okay, it brings this level down, which is great. Krill oil also shows that we lower triglycerides and LDL cholesterol too, because that's what we're trying to do to reduce that cardiovascular level too, right? I think this might be the last one, but magnesium cardio and taurine, B6, and zinc. I love this. Magnesium, oh, everyone, I feel like this is the number one recommended product in my practice, at least, is magnesium because it does so many things on its own. But this magnesium cardio product has some really great other nutrients in it. So taurine, B6, zinc, these things really helpful for just maintenance of the heart. Magnesium. I always give magnesium to people that are stressed out because it reduces their, it doesn't reduce their their heart rate, but it helps stabilize it. Okay, so if there is a chance that they're going to have some sort of arrhythmia, it's going to help stabilize that. Magnesium is really needed in the relaxation of muscle contractions. Remember, I talked about the heart being a muscle, it contracts and then it relaxes, and magnesium is what's helping it relax. Taurine is anti-inflammatory, helps with blood pressure regulation, it's shown to lower serum lipids and reduces the oxidation of LDL, which we know is what's damaging the endothelium or the inside of the blood vessels. B6, reducing homocysteine. Okay, that's a big one right there. Zinc. Zinc does a ton of stuff in the body, but in this case, it's reducing the total LDL cholesterol and triglycerides, and also helping with immune system, helping with testosterone levels. It's so good. Nattokinase. That is not the last product we're going to talk about. Nattokinase. This is super cool. There's some really great research coming out about this. It comes from a Japanese dish called natto. It's connected to longer lifespan in Japan and lower chronic disease rates. And so then we're like, what? That's crazy. Do some research. We found that the people that are eating this in Japan have healthier lipid balances, lower inflammatory markers. And what we do know in lab studies, it breaks up clots. It like disintegrates clots. And that's incredible, absolutely incredible that it can do that. It can like start to chip away at the plaque, but not at a level where you're going to throw clots and get certain blockages. And of course, it's going to help support blood pressure as well through the kidneys. Oops, sorry. Just 1 cap per day, nice and easy. Red yeast complex. This is something that I use like every week. I'm recommending people to take this in my practice. Okay, so red yeast rice. I like this one because it has that thing in it. Red yeast rice is a yeast that has been shown to bring down LDL cholesterol and triglycerides. It has this thing called monocolin in it, and it is the same structure as lovastatin. Instead, lovastatin is a drug that's developed to bring down cholesterol. Okay, it has similar effects. Okay, without the side effects. Okay. Red yeast rice complex also has the other things for the heart, CoQ10, because red yeast rice can bring down the levels of CoQ10 in the body. It also has vitamin C because it's helping the absorption of CoQ10. It's also an anti-inflammatory and an antioxidant. It has choline and lecithin in there, and it has this thing called plant sterols, and they reduce cholesterol by limiting the absorption. Okay, so it's kind of like fiber, right? Like we want to eat a good amount of fiber to grab onto the cholesterol that's pushed out through the gallbladder and the bile ducts. Okay, that fiber grabs onto the cholesterol, and we poop it out, and our cholesterol levels come down. Like what's the oatmeal? Steel cutouts have been shown to reduce cholesterol levels by that mode. Very interesting. So main takeaways here, man, we covered so much stuff today. But the main stuff here, get objective data for yourself, okay? Like blood work and blood pressure. Blood pressure monitors range in price from $20 to $100 commercial or at the consumer level. Get one on Amazon for $40 if you're like worried. Take it in the morning. Take your blood pressure in the morning when you wake up. Be physically active. Okay, this doesn't mean you have to go to the gym, but definitely helpful if you do that. You have an accountability partner there. Go for a walk. Okay, eat fibrous foods for the reasons I said earlier. Because it grabs onto that cholesterol and reduces it, reducing stress and improving your ability to adapt to it. Maintaining a healthy body weight, managing healthy blood pressures with diet or medications. If you can't manage it with diet, try a medication, bring it down. Use high quality products to support cardiovascular risk profile, like the ones we talked about earlier. The best way to do this, okay, don't go and just buy all of them. Okay, go and like speak to someone specifically. Like speak to a naturopathic doctor about your situation, and then you can get what you need. Okay. Like taking 8,000 supplements, not always helpful. Like the bigger drivers of change are going to be the boring ones I talked about earlier, the dietary stuff and the lifestyle and the physical activity. Okay. Those things, if we can make those changes, we will make so many more, we will live so much longer. Okay. Supplements help for sure, but those are the bigger drivers. That's it. Man, we covered a lot of stuff. So give CanPrep a follow on Instagram, and Facebook and Twitter and TikTok. I guess it's X now, isn't it? Or Twitter's now X. But you can also go to camprep.ca. They have so many great resources there, and feel free to reach out to your local naturopathic doctor, and get yourself, talk about longevity and talk about your concerns, and most of the time, if you have extended benefits, they'll be covered. Okay. If you've enjoyed listening to me today, I really appreciate you guys. Thank you so much. If you like what you hear, like go and follow me on Instagram or check out. I'm more active on Instagram than other platforms. I'm on Facebook, and you can look at my website, drrorygibbons.com. And if you want to email me, feel free to email me at hello@virtualhealthcollective.ca, and I'll get back to you as soon as I can. Life's crazy over here. I'll do what I can. If you have any questions specifically about the CanPrep products, I encourage you to email CanPrep them specifically, because they will have all the answers for you, including the research behind them. And it's all great. Okay. So let's take a look at the questions. Why can't I see the question box? Ah, thank you. Okay, questions. I'm going to try to answer as many as I can here. Why do I get gas around my heart when eating cabbage? You don't. I would say you probably don't. You're probably getting gas in your stomach and your upper intestine. There. I heard recently that omega-3 is not recommended to take if you have heart disease. I had a triple bypass 2 years ago to artery blockages and wonder if I should continue. I'm wondering if Rose is answering these. Okay. This one says, no one talks about bradycardia when it comes to heart health, which I have, and wanted to know if there's a supplement that could help. Um, yeah, I mean, I for bradycardia specifically, like not that I know of. I've never really come across bradycardia as an issue in my practice. Definitely talk to your naturopathic doctor there about that. There might be some other things that you can do, like when someone has low heart rate, there may be a low blood pressure picture here. So there are some things that you can take for low blood pressure to bring it up. That's a tricky one. Bill says, I'm currently taking cholesterol pills. Can I take B3 supplements instead of my prescription? I'm not going to make any suggestions on replacing your cholesterol pills. B3, I don't know. I haven't seen. Oh, B3, niacin, right. Uh, Definitely talk to your doctor about that. Niacin has some really great research around bringing cholesterol down, but I'm not going to tell you to stop taking prescription pills for sure. Is the COVID vaccine a part of the heart problems? And life flipped. Yeah, I'm so sorry about that. To hear that story. I can't really comment on that. It's like COVID vaccines, like this is the thing with COVID vaccines. We can talk about how COVID vaccine did this thing, but we also have to remember, that almost everyone was infected with COVID at some point. Okay. And this might anger some people, but I'm talking in generalities here. So I can't really comment on that. I don't know if this specific situation caused an AFib. Really, I hope things get better for you. Do you use calcium score to assess cardiovascular disease? That would be great. I would love to be able to use this. more, but you have to refer for it, and it's hard for me to refer for that. I use all the other tools that I can. You can talk to your doctor, your GP about the calcium score, but this usually comes up later after you've been diagnosed with cardiovascular disease, or if you have failed a stress test or something like that. Teresa says, how significant is low triglycerides for cardiovascular risk? I don't know. I don't know how to answer that one. Good evening. How can cholesterol and diabetes type 2 reversed? How can menopausal females reverse cholesterol? Does the heart beat differently for them? What advice can you give all menopausal women? Well, I'll just focus on the last one because it kind of addresses a lot of the other ones. What advice can you give all menopausal women? Number one, see a naturopathic doctor that understands bioidentical hormone replacement therapy. This might be really helpful for you. Second one, strength train. It's never too late to start. Go lift up some heart. Go lift up some heavy stuff and put it down. It's going to help so many things. And then your heartbeat does not beat differently, but hormones can change the way our heart behaves. Yes, but it doesn't beat differently. And how can the other things be reversed? Just what I said in the presentation today about diet. Fasting insulin is an interesting test as it can identify prediabetes. Why don't doctors look at this test more often as a way to help diabetes prevention? Yeah, doctors don't look at this test because it costs more money, one, but also there's just no defined parameters for fasting insulin. Okay, and you have to like look at fasting insulin, look at fasting glucose, you calculate, and then you have to incorporate other certain markers and other certain lifestyle and dietary factors in order to have it, in order to make any use of it. And so for GPs, the way they're trained is that once you get to a certain glucose level, then you deal with it. Okay, and that's when you get to diabetes, then you deal with it by medication. Okay, and unfortunately, GPs are like in their training in school, like from my understanding, they're not taught a whole lot about the dietary and interventions. Like they're taught about the cardio or DASH diet and portfolio diet and stuff like that, but they're not really taught how to implement them. And then if you go to your GP, how much time do you have with them, right? Like you're kind of like, okay, eat better by doing this thing. Good luck, right? And then they're doing the best they can. Again, speaking in generalities. I like to use fasting insulin though, because I have more time. I have more time to incorporate it into my practice and teach people about it and teach people how to eat properly and differently to help them live longer. I don't know what that means. Cheryl says, thank you. They can't find anything wrong with my heart, so I thought I was losing my mind. Appreciate the help. Okay, great. I'm glad everything's fine there. What are inexpensive, healthy, organic omega-3 proteins and anything in menopausal should we consume in our daily diet? You need to go talk to your naturopathic doctor, please, because everyone's different. And what I can say is don't cheap out on supplements because they won't do good for you. Like the cheap ones are cheap for a reason. They can be full of fillers. They can be not as pure and not as like concentrated. Same person says, is it true that people have to take curcumin if they take a cholesterol tablet? I answered that already. Coconut yogurt is recommended instead of dairy. Does it have lots of saturated fat? What do you recommend instead of that? The purpose is calcium support. Yeah, calcium is good. I don't know. I've never heard that coconut yogurt isn't recommended instead of dairy. Maybe if someone is dairy intolerant or lactose intolerant, that might be a good idea. If you're a person that needs calcium support, there's a lot of other stuff that you can take. You can have, leafy greens. Leafy greens is one thing that I encourage everyone to eat. Fish, there's calcium in fish. There's, you can take a calcium pill, like a CalMag supplement. Those can be really helpful depending on your situation. You may not need any supplementation for calcium. Bradycardia, I talked about that. Is air frying not good then? I did I did talk about air frying. Air frying can be helpful. It's better than deep frying, but there are some certain foods that get oxidated when you're air frying, and it can change the molecular makeup of that food, which can be harmful to your health. Do you agree with Brazil nuts to lower cholesterol? If so, how many days safe? Um, I would go to yeah, Brazil nut. I've heard that too. I don't reach to the Brazil nuts as recommendations very often. Maybe I need to learn more about that. I'm not sure. What you can do is go to examine.com and see if there's any information there. Just type in Brazil nuts, examine.com, and they'll bring up some studies on that. Penny says, my doctor wants me to go on statins. I don't want to. Any suggestions? Yeah, lots of suggestions. The number one, though, is tell your doctor why you don't want to go on statins. See if there's another option that he or she recommends, because there are a bunch of different options as far as cholesterol lowering medications, even within the statin medication family, because there's like 10 different statins, and some of them have lower chances of side effects to happen. Okay. The red yeast rice complex is something that I've talked about earlier that has similar effects as statin medication, but depending on your situation, you might need a short course of statin to bring it down into normal range. Talk to your doctor about that, and if they're not willing to talk to you about options, talk to a naturopathic doctor about it, because we have more time and we have similar knowledge as they do, and we have a different outlook on food and lifestyle, right? Susan says, does genetics play a big role in heart disease? Sometimes. Atherosclerosis? No. Unless you have familial heart disease, or sorry, familial hypercholesterolemia, where you have a defect of LDL production, where you produce a ton of LDL, then those people can have a higher risk in heart atherosclerosis. Why do liposomes need to be refrigerated? Because they'll break down otherwise. Some products need to be refrigerated. Can you take CoQ10 if you're on heart meds and blood thinner? I believe so. I'll have to double check that. Is there a product that contains all these ingredients? I don't know what all these ingredients are, but Healthy Heart is a really great all-round product for heart health. Diana says, is there a big difference between krill oil and plant-based omega-3 oils? Yeah, okay, so omega-3 fatty acids are all biochemically the same, but when you look at a plant-based omega, you just can't find one with a higher concentration. This is the thing, like you have to take a ton of the plant-based stuff in order to get the same amount of essential fatty or omega-3s as a fish-based one. Okay. And also the EPA and the DHA, the subgroups of fatty acids in there are different in plant-based versus fish-based or fish oil-based. Okay. Fish oil-based higher in EPA. In krill oil, very high in EPA. Plant-based omega-3s higher in DHA, which is more brain health, right? This person says, why CanPrev versus other brands? Is it better to take coenzyme liquid versus pill? Why CanPrev versus other brands? CanPrev, they do a lot of research. Sorry, not research. They do a lot of, they formulate their products based on solid research. Okay, so for instance, the red yeast rice complex, there is 200 milligrams of red yeast rice in each capsule. They recommend one capsule 3 times a day, which is a minimum of 600 milligrams per day, which has been shown to reduce cholesterol. Anything lower than that hasn't really been shown to do much. Okay, so that's kind of an example. Same with magnesium. They work very hard to use great studies to support the dosing and the formulations. Also, they try to use sustainable farming practices. They use sustainable ways of sustainable harvested fish oils too. So I love Canprev because they are trying to produce products that are therapeutic for people at a price point that is reasonable. Okay. So if someone said like, can I get a cheap one? My thought is don't get a cheap one. Get get one from Canprev because it's a great product at a reasonable price compared to the other higher end products. Coenzyme cute. Coenzyme liquid versus pills. Yes, it absorbs better. Is atrial fibrillation life-threatening? It can be, but if you have not talked to anyone about that, Monica, or please do. Okay. Depending on the person, atrial fibrillation can be pretty rough. Okay, so we're coming up to we're at 5 o'clock here. I'm going to answer a few more questions here, and the other questions. Oh man, there's so many good ones. I'm going to answer a few more. I'll go to 5:05 here. Speaking of stress reduction, is there any insight in ashwagandha usage? Yes, it's good. Get a good ashwagandha. Look at anything that has KSM 66 in it. How effective is red yeast rice in lowering cholesterol and triglycerides, elevated CRP? Yeah, yes, it reduces cholesterol levels, and elevated CRP usually is related to heart disease, but also not always. If you have an autoimmune disease, CRP can be higher, but it doesn't necessarily mean the heart is affected. So it's high sensitivity, low specificity. You mentioned zinc helping with testosterone. Mine is a bit high as a female, and I've had issues with hair loss, so will zinc help? Maybe, but there's other reasons why you might have hair loss. Okay, high testosterone could be one. Also, your thyroid might be off, your ferritin, your iron might be off as well. So you need to talk to someone about that. Get a good like plan together. Can you take krill oil in addition to omega capsules? Yeah, you can take both. I just take krill oil. Take one of them. I exercise 12 to 13 hours a week. My HDL is on the low level. How can I bring up HDL? Exercise and omega-3s are the ones that I recommend. Is rice bran oil bad? Is tatin endined bad? Or has a sub? Rice bran, I don't really have much experience with the rice bran, but I feel like it does reduce cholesterol oil or cholesterol. Statins can have side effects. I think that's what that question was. I have a family history of heart amyloids. What can I take? I don't know. I really hope I need you to talk to someone about that. Okay, someone that has a specific focus in like genetic disorders. Are chips okay to eat like you do? Touche. I love chips. I eat them in moderation. Okay, I have them usually on the weekends as a snack. Some of them do have hydrogenated oils, which are not the best for cardiovascular disease, but I do have a soft spot for some Tostitos. So have chips once in a while. Have them with like some really fresh guacamole or from some like ready or some fresh like salsa. Get some like great antioxidants in there. This is how I justify. I mean, go into the Tostito, I go down the chip rabbit hole, but try to keep them plain. What's your opinion on beet powder? Depends on what it's for. Why do you recommend the DASH diet for heart health? Salt is extremely important for controlling arrhythmias and heart problems. This is individualized, right? So if someone is having an arrhythmia, salt is important. You're right. But we also have to remember if they have high blood pressure, we need to be mindful of the salt and of salt in the diet. That's just what research has shown us. Can you please respond to the question about omega-3 being not recommended for heart conditions? Dr. Rory just went to the next question without giving the answer. Omega-3 not being recommended for heart conditions. Oh yeah, okay. So the omega-3 is not being recommended for heart conditions. It's not really not like I've never heard them not be recommended for heart conditions. I have heard doctors say like it doesn't have a use. Okay. But what we do know is that omega-3 fatty acids can bring down they can bring down cholesterol and triglyceride levels and CRP levels. Okay, so that's why we talk about krill oil tonight. If you take an omega-3 fatty acid and you have a heart condition, like the level of harm, I don't think there's a level of harm even there. Okay, but again, you need to talk to a doctor about that. And also, if you're taking blood thinners, there has been some research there too that says that don't take those together. Um, that's going to be a really individualized question. Okay. Okay. I'm taking blood pressure meds and blood pressure is down to 120. When I go to the doctor, it's very high. I don't recommend a supplement for that. That's called white coat syndrome. Okay. That was a lot of questions. I went a bit over time, but I hope I was able to provide some valuable insight into um, provide some valuable insight into cardiovascular disease. Thank you so much for listening. I appreciate you guys so much. And have a wonderful night. I'm going to stop sharing this webinar. And I see some people thanking me in there. Thank you so much for that. I appreciate your attendance tonight. Okay, we had a great turnout. We had about 170 people. I think about 180 people attend. So my closing thoughts is find a great naturopathic doctor to work with and have them on your health team for the rest of your life. Okay. If you need suggestions, just start reaching out to CanPrev. They have some people that they recommend, and so do I in Ontario. Okay. Have a wonderful night. I'm going to stop sharing. And that's it for today.